Hi guys, my name is Jennifer Wilder, as you know, and I apologize again for the lateness in this presentation. I had to take a staff member to the hospital and then I got strep throat, so again, I'm sorry and I apologize if my voice breaks. I'm still trying to get over it, but I couldn't get anybody else to give this for me, so fingers crossed that I can handle it for this presentation. Okay, so I chose muscular dystrophy as the disease that I wanted to focus on for this. The description, I hope you guys can see this, hopefully. It's actually 30 different disorders. All of them are characterized by progressive muscular weakening and dysfunction. So it's a group of diseases, it's not just one. Currently there's no cure. Some forms are mild and the person can live a fairly normal life with MD. Some of them are severe and it's a very, very short life expectancy. Again, it depends on the type that you have. We'll get into that here a little bit later. Actually, I think maybe on the next slide. Let's see. Okay, so it's caused by kind of a series of events. So all of you guys are exercise majors of some kind, so I'm going to shorten it up. MD affects the fiber membrane of muscular tissue. So all of you guys know this. Muscular tissue is surrounded with membrane. In a patient with MD, that membrane is weakened, so the creatine leaks out and calcium leaks in, which affects the muscle's ability to contract at a normal rhythm, and all of those things combined eventually kill the muscle. And somebody with MD has a much harder time replacing muscle than a normal person, and muscle is kind of hard to replace to begin with. Okay, so adaptations for sports, fitness, and recreation. Again, it depends on the type of muscle affected. So some forms of MD affect respiratory muscle, others affect cardiac muscle, and others affect skeletal muscle. So again, it depends on the kind that you have. And there's a couple of variations within the skeletal muscle types too. Some of them are joints, some of them are only the upper arm, some of them are lower legs, some of them are intestinal cardiac muscle. There's tons and tons of different varieties, so this is super generic. Types of treatment, again, depends on what you have. So if you've got a patient that has a respiratory version of MD, they're going to have a hard time breathing. So that kind of person is going to need access to a ventilator or an inhaler or something like that that can help them breathe a little easier. And in the classroom and the workforce, which we're going to get into in a minute, they're going to need to be able to leave to get a ventilator mask occasionally. Somebody that has the skeletal muscle form, which is the most common kind, would commonly use steroid therapy and physical therapy combined. So a lot of you guys know the ramifications of a steroid. They tend to be a lot more excitable. It is an anabolic steroid, so kind of build up the muscle that's starting to generate with MD, so they're going to end up with all of the side effects that you usually get from an anabolic steroid. And a lot of them also take immunosuppressive drugs because MD does affect your immune system. So anybody that is taking those kind of drugs is going to obviously have a weaker immune system. They're going to get sick much easier. And somebody that's affected with that kind of MD would need access to medical care much, much quicker than the average person does because they don't have the ability to fight off infection like an average person does. So somebody that has many of these forms are going to get tired very easily. There's kind of a catch-22 with MD, which is you have to keep your muscles in shape and healthy as much as you can, so they have to do kind of a light exercise, but like I said, they don't have the same ability to recover from exercise, so you also have to take it kind of easy on them as well, because if you break down their muscles too much with exercise, they can't recover like a normal person would, so you have to kind of find that balance for them. There's a bunch of different kinds. We'll get into it a little bit later with my equipment adaptation, but pool workouts are great, light activity is really good, and a little bit of activity, like I said, is really, really helpful because it helps them maintain their muscles for as long as possible until the disease starts working its course further. Okay, adaptations for games and recreation. 4 main kinds that we're going to go into. Instruction, rules, equipment, and environment. So instruction. Like I said, MD affects many, many, many areas. It can affect your eyes, it can affect your brain, it can affect your heart, your lungs, your muscles in general, just pretty much anything. So a patient with MD is going to be very, very different from another patient with MD. So in instructions especially, it's really important to make sure that you're giving instruction in several different ways so that if the MD is affecting their methods of communication, they can rely on a secondary form. So you're going to want to give instructions verbally, written if you can, in several different methods because some of them affect cognitive ability, so in several different ways. Some of them are going to need a sign language translator, some of them have a minder to help them. The patients that have MD that affects their ability to hear, obviously you're going to need some sort of adaptive way to get instructions through to them. And the ones that have cognitive versions of MD are going to maybe need different rules that are a little easier to understand. Rules. So, like I said, MD patients get tired very easily, so you might have to modify the rules. If you're playing like soccer or baseball or basketball or something that has a court, a lot of patients with MD are going to need a shorter court so that they don't have to go as far, or a designated runner or something like that so that they don't have to expend themselves too far but can still participate in the game. Equipment, which again is going to be what my equipment adaptation works on, but patients with MD are significantly weaker than anybody else in their age category. Like a patient with Duchenne's MD, which is the most common kind, by the time they hit high school, oftentimes they're already looking at having to go into a wheelchair. So they need adapted equipment that's easier to use. So I know here at the 4-H Center with archery, we have these kind of peg things that you can put a bow and arrow on and then pull it back kind of horizontally. I'm going to show you guys what that looks like later in my next presentation. And it makes it so that they don't have to spend strength just holding up the bow like a normal archer would. So you have to kind of adapt the equipment to make it easier to use and less stressful on muscles that are already stressed. And then environment. With any kind of a disability, you want to make sure that you're including the person with the disability as much as you are anybody else in that environment. So it's up to you as a facilitator or a coach or an instructor or whatever it is that you're doing with these people, that you've created an environment where they're not singled out for being a patient with MD. So a lot of that kind of comes back on us as professionals to create an environment where they can participate well and fully. Okay, problems encountered for a patient with MD. Mobility, number one. Like I said, somebody with some strains of MD are going to be looking at a wheelchair before they even graduate high school. So wheelchairs, crutches, braces. Some of them are going to have other assistive devices. Some of them will have service dogs. And like I said, there's a very, very careful balance between activity and inactivity. You have to work them out hard enough to where they can maintain current muscles, but not so hard that they have a hard time recovering from that activity because they don't recover as fast. Possible accommodations in the classroom. If you've got a young MD patient, they're going to need additional time to complete assignments, especially if they have one of the cognitive forms. You're going to have a lot of leeway with attendance because they're going to have to leave occasionally to go through physical therapy, and like I said earlier, if they have to get the ventilation treatment. And they're going to need opportunities to go get the treatment because some of it is time sensitive. In the workforce, like I said, unfortunately, a lot of the people that have MD start at childhood, so by the time they get to adulthood and enter the workforce, they're going to need a little bit more help. So accessible buildings for those that have wheelchairs or crutches, an environment where they can have a service dog if they need it. Excuse me. Periodic breaks, because MD, you really want to avoid muscles locking up too much because they don't, again, recover like normal muscles do. So you need to have them to where they can get up and move around and not stiffen up too tight. Excuse me. They're also going to need the ability to work from home occasionally so that they can receive those treatments and keep as normal of a life as they can. And charting components. Most of them are going to be behavioral, especially for the younger kids that are having to confront the disease as early as some of them do. So like I said, especially the kids in high school, the ones that all of their peers are getting ready to go into sports and start competing at a high level, and they're all of a sudden having to go into a wheelchair. So a lot of them will have adjustment problems. And you have to watch for progression of disease, especially if you have a patient that has a cardiac or a respiratory version of it, because it does progress a little further and they might need more and more help as the disease works its course. And of course you have to keep out an eye for signs of depression, because it is a very difficult disease to deal with, and like I said, there is no cure. So a lot of patients struggle with that, and they struggle with having to accept more and more help, especially, like I said, if they're younger and their compatriots are starting to move ahead and they're suddenly moving backwards physically. Those are my references. If you want me to send them to you, I can, because I know you probably can't read them on this small screen. And that's it. Thank you guys. I hope this was understandable. I can send you a written version of everything that I had if it's going to make it easier to understand. And I'll talk to you guys soon with the equipment modifications. Thank you.